think
Hello.
connected.
Hello, yeah.
Finally.
Hi,
Hi guys. Can you hear me and
Hi.
see me? Please confirm.
Yes, perfectly. Perfectly. Can
Alhamdulillah.
hear you and you're clear. Thank you for joining us today. We're so
You're
excited to
welcome.
start a very important topic, we believe, for new parents and all the parents now with COVID. And we just would like you please to start by introducing yourself to our community before we start.
Hi. Sure. Hi. Good afternoon. Yes. Good afternoon, everyone. This is Dr. Mina, a pediatric dentist in Dr. Joy Dental Clinic in Mirdif branch. I was born here, brought up here, even did my master's in pediatric dentistry in Dubai, and have been doing pediatric dentistry for, let's say, 8 years.
That's a lot of time. Dr. Mina, we just wanted to start by asking you, like, by what age should parents start brushing their children's teeth? And
From day one.
From day one. Wow.
Yes.
Any techniques that you're using?
Day
Yes,
one of his teeth coming up, or
No,
your gums?
the reason why I'm telling you from day one, because you need to train your child that there's something entering his teeth or his or her teeth. So there are a couple of scenarios. The first scenario, you get a wet gauze. This is a tissue. So just imagine it's a gauze or a wet cotton. You wrap it around your finger like this, okay? And you just put some water and just imagine your teeth. There will be no gums for the baby. And all you do, you just massage it. All you just do is just massage it. Why we do this? For a couple of reasons. Because if the baby is breastfeeding or even bottle feeding the formula, both of them have sugars. So you need to wash off all the sugars so it doesn't have a bad smell. Because even the baby, there is bacteria, even good or bad bacteria inside our mouth. So it will eat the sugars and it will start doing bad smell. Plus, also you need to train that child so when he grows and have his starting teeth, the child does not resist the idea of brushing later. So that's why we say from day one. And I can send you a couple of videos. There are 2 videos. Even there's a silicone brush that you find it in the pharmacies, you find it in the supermarkets. Yeah, you can start using that when they start having teeth, or with just a silicone, without it, or just as I told you, either a wet gauze or tissue, or even there's dental wipes. In some pharmacies, there are dental wipes.
Okay, and it's safe to use those. It doesn't have to be a specific brand or.
No. If you want to be extra safe, the gauze will be fine. Wet gauze will be fine.
Okay, and by what age do you think they should? When should they book their first dental visit?
In the first birthday, when the baby is 1.
Is one.
When
So
the baby
just
is
to
1.
check up, even can you see at the first early ages the constitution of the teeth and how it's gonna be, even if not all the teeth are up?
To an extent, I cannot tell you it's 100%. I can tell you to an extent, of course. But in general, when the child comes for the first visit, from the teeth you can see what is the patterns. You know if the mom is brushing or not, what kind of milk, and then we can start guide the baby, because when the child is 1, he still doesn't have all his or her teeth. So from the pattern of what you see, you can guide the parents. So that's why we say from the first birthday. Please remember, prevention is better than cure. So from first birthday, we help them to prevent.
So what are the signs of teething exactly? And is there any soothing technique that you can recommend? We got all of those questions before.
Sure. Signs of teething. First of all, you should know when to expect teething. So you don't get mixed between medical and dental. Usually the first teeth that erupts is the lower teeth down there at the age of 6 months. And the girls will be a bit earlier. Girls are always earlier than boys. We'll say maybe 4 or 5. Yeah. 4 or 5 months, and then you'll find the baby will always try to pull his ear sometimes. He will try to bite anything that comes in the way. Excessive drooling. You find him excessive drooling, biting. What else? Yeah, you might find a slight raise in temperature. Please, and this is very important, do not get mixed up. If it's more than 38.5 for 2 days, it's not more dental. I'll repeat that because it's important. More than 38.5 for 2 days, it's not more dental. Okay,
Okay,
and
because parents always mixes up.
yeah,
Because
and
parents always,
slight,
yeah.
yeah, and you might also find slight diarrhea, slight diarrhea. Again, not more than 2 days.
So are there any hidden issues that that mothers should be aware of?
I'm sorry, I didn't
Like
get your
any
question. What do you mean by hidden?
it means like any complications, if it's like normal teething, or if there's like I don't know, any hidden aspect that mothers should be
No,
aware of.
the only complication if the child, for example, let's say is 1 year and did not get any tooth out, it's just like I'll say a question mark. Then it's better to
Okay.
come to the dentist, have an X-ray, see if the teeth are there or not, because there are some cases kids are born without teeth or they have a medical condition we need to work out together. So that's the only complication I will just tell you about it. Just take care.
Okay.
And what about, do you recommend anything about like how to soothe this teething? Because we know that we have a lot of technique, usually moms, they give something to chew on, like ice or like those iced.
Ice is right. Yeah, there's the ice toys you guys put in the freezer, and then he
Yeah.
keeps biting. It helps him to relieve. That's the magic trick. Also, there are baby gels, teething gel. But please be careful. There are two kinds of gel. There are kind of one with topical anesthesia, which we don't recommend, and there is one with natural or like so-called hyaluronic acid. For example, there's a very famous brand, and even you see a baby on it. It's called Teething Baby Gel, Cincy Gel. Sorry, Gingy Gel. Gingy Gel.
Okay.
Gingy
We
Gel.
have we have Cynthia who's asking that what could be the medical
Don't tell me.
condition if there is a delay in teething?
Sorry, the sound went off. Can you repeat that, please?
Okay. So Cynthia is asking what could be the medical condition if there is a delay in teething?
No, a lot of medical conditions. It's like I cannot tell you exact a medical condition, but we take history. I cannot tell you now the whole of the medical that I have learned now. But no, nothing to worry, nothing to worry. When I say medical conditions, for example, she would know. For example, God forbid, if the child has a Down syndrome, that's a condition. But it
Okay.
doesn't mean if he's delayed. I mean, let me correct myself. If there is a medical condition that we know of, it might be related to teeth. I mean, the teeth can be a signs of it, but I cannot tell you what's the medical condition. If we know a medical condition, or we'll figure it out together, but I cannot tell you what's the medical conditions. No, it doesn't work out this way.
All right. We have another question actually. What
Sure.
about the kids who still takes the bottle in bed and we wait for them to sleep on the bottle and we don't go back to brush their teeth and just
You are giving a bacteria a golden plate gift, especially
oh
the
my God.
formula. You are
But
giving
sometimes,
the.
like
Sorry, say
sometimes
that again.
sometimes with young babies, it's inevitable. Like they have to sleep.
At least brush for me. They do not sleep with the milk on their teeth. The next, whoever mothers are with me, or you guys are using still the formula, I want all the mothers, please try this. The next time you prepare the formula, I want you to taste it. It has
It's
two problems.
very
It's very what?
Sweet.
it's very sweet.
Thank you. That's the first problem. Second, it's very sticky.
Yeah, true.
So,
True.
so bacteria inside, it's dancing. They're doing their party night. So, and you see a lot of kids, and my proof is you'll see a lot of kids, especially these front teeth, either they are brownish or they are black. It's because of the formula milk. Even breastfeeding does that, because breastfeeding has sugars, but it's not sticky, so it's less disaster. But the main disaster is the formula.
So what should we do in this case? Should we give them
First,
water or should we like go back
First
and
of
keep
all,
it?
first of all, check with the pediatrician. Please check with the pediatrician if you can move to fresh milk. That's the first.
Okay.
Even the fresh milk, you still need to brush because it has lactose. Lactose is sugar, so you still need to brush. Second, if you cannot avoid the formula, give the second thing we need to talk about or later is if your child is above 2, do not give the bottle anymore. It has to be a semi cup. So
Right.
after that, either you give them a water, so they drink water, and just by the way, FYI, most of the kids they don't want what makes them sleep is not the milk, it's the sucking motion. It's the sucking motion. So if you give them plain water, they might sleep. So you can try, instead of giving milk, give them water. If this doesn't work and the kid still wants the milk, then please, the kid does not sleep with the milk on his teeth. You need to brush. Again, as either you brush with, and especially if you have a teeth, then you start introducing toothpaste with fluoride. So either with a wet cloth, as I showed you the first time, or with the brush. Do not sleep with the milk on the child's teeth.
So this was actually our next question. What's the best toothpaste? It should be with fluoride, right?
Yes.
Okay. So
But
does the type of toothpaste affect the coloration of the teeth? Like I
no.
know from my it doesn't. Okay.
No, because the fluoride that you have, I'll show you. I have some samples for you. The fluoride that we have here in Dubai on the toothpaste, first it's very minimal. You go with all the guidelines, so it doesn't affect. And people who usually are born with fluoride problems, they used to take fluoride when they were a baby, either tablets or too much fluoridation, which is not in the UAE. Because most of us who drink, we drink water, like for example Nestle. We have this Nestle, and if you go there, it has fluoride. It's less than 0.01. That's below the minimal requirement. So fluoride does not cause any stains. But what's very important to know, what are the correct amount of fluoride to be used. So in general, the guidelines, it says from 6 months to 2 years, you should use a 500 ppm fluoride. From 2 years to 6 years, it should be 1,000. And then 6 and above, it should be 1,450. So for example, this is Vitus Kids. I don't know if you guys can see it.
Yeah. Yes.
Yes. Okay. So here, I'll try to bring it more closer. So here he says 2+. Okay. Okay. Yeah. And if you go at the back, you'll find it's written 1,000 ppm fluoride. Just written. So yeah, here. I know it's very small, but I'm just trying to. Yeah. So this is so if you have any child above 2, automatically use this one. Okay. And if you have above 6, then it's junior. Even it's here 6+. You can see it here 6+. Yeah. Mm-hmm. Okay. Are those in the pharmacy as well? This is in the pharmacies. These are the pharmacies. I can give you a code now. You can order it online, and it's free delivery, even if it's one, and you'll get a 10% discount. So perfect. I'll send it to you if you guys want.
Great. Thank you so much. We have we just a small question. I have, my son is 10, and sometimes he uses our own toothpaste, like adult toothpaste. Is it harmful, or he can?
No. Usually at 10 we consider them adult already in terms of teeth. Yeah, in terms of teeth. Just make sure that he has fluoride. And what I recommend also from the same company, anyone above 6, start using a mouthwash called Anti-Caries mouthwash. It's amazing.
Okay, perfect.
We have another question from Veronica. She's asking, what is the ideal time to brush baby teeth?
She mean during the day or when?
We're gonna ask her actually. Veronica, did you mean, is it during the day, or what do you mean by what's the ideal time, or by the year? Because I think you joined later, so
she means by
what age maybe?
Yeah.
Okay, let me tell her both. Okay, I saw her question.
Both.
Okay, so Veronica, again, you start from day 1, from day 1 of the baby. And when, so the new guidelines, you say you brush before breakfast and before you sleep. Okay, the second thing, which a lot of mothers are arguing with me, we cannot floss. Floss is 40% of your cleaning. Floss is 40% of your cleaning. I see a lot of kids, Doctor, we are brushing our teeth every day, blah, blah, blah. All the cavities are between their teeth. All the cavities are between the teeth. And you don't see it with your eyes. I see it with my x-ray. So flossing is a mandatory.
Yeah, here we have 2 issues actually. Another person asked, my son is 2 years old. He hates the taste of toothpaste, strawberry, mint. He just spit it all. He likes to brush though. The challenge is to force to do it with a toothpaste. So what to do in this case?
Try different toothpastes. For example, the Vitus one, actually, almost it doesn't have any taste. This one almost have doesn't any taste. Plus, put a small, try to, for example, we usually say put a pea size. Above 3, put a pea size. If you're below 3, put a smear layer. So it's a little tiny, just a drop, and just try a different toothpaste. Worst case scenario, you can avoid the toothpaste, but I don't recommend it.
Yeah.
It's useless to brush without the toothpaste at the age of 2, right?
Yeah, yes. So I like to do the chance for to the toothpaste. If you also another thing you can do is try to first let them, because kids are copycats. So let's agree on that. Kids are copycats. So what you can do first is let mama or baba brush with the toothpaste, with the kids' toothpaste, and just act that it's amazing. They might accept it too.
Any recommendation for flossing also? Like how do you think, even flossing in front of him, he won't like get it.
Yeah,
Yes,
sure.
I have. You know, I had one. I don't know where did it go. Just a second. Yeah, I have it here. Yes, here I got it. I got one. Yeah, here we go. So I highly recommend this floss. It's the easy one. This
Okay.
you get it. You get it in Carrefour. You will get it in supermarkets anywhere, or this one, the small one. These have sizes. You use the smallest one. I'll just show you why it's very important to brush. Yeah. So just, can you see this is your teeth? Yeah. The brush goes like this, goes like this, goes like this. See, it did not enter here.
Yeah.
Especially people who are going formula. Remember we said the formula is sticky. So all your cavities comes here. All your cavities comes here. So just imagine this is the floss. You'll go like a seesaw, left and up. Again, like a seesaw, right and up. I'll do it one more time. You go like a seesaw, left and up. Again, like a seesaw, right and up. Flossing, all we need is once per day at night. You floss first, you brush, and then, you rinse and you spit once. Do not wash more than once, because the more you wash, the more you're removing the effect of the toothpaste.
Okay. Oh. We have actually another question. How to train a 6-year-old to gargle with water after toothpaste? And is it better to use mineral water instead of tap water?
So I'll just explain this. There's a difference between gargle and there's a difference between a mouthwash. The gargle, if you have a throat infection, we'll ask you to gargle. If you want to gargle, it's just, again, kids, remember, it's a copycat. Just teach him. If it's hard, then just ask him to mouthwash, rinse. Yeah. The second thing, you need the guys to know that the new guidelines now, you do not use a mouthwash after the toothbrush. It should be during the day, because acting together, they will delete the action of each other. In very certain cases, and if, for example, people have gingival problems, we describe a certain toothpaste and a mouthwash to be used together. But the new guidelines do not use the mouthwash and the toothpaste together at the same time. So in general, what we say, for example, first you brush in the morning, and then have your breakfast. And now I know kids khalas are on vacation. God bless mothers these days. So so let's say they have a snack at 12. So I will not ask you to brush. I will ask you to use a mouthwash. And if, for example, Vitus has this anti-caries, it comes with the cup. Fill the cup, no water. They rinse for 30 seconds and they spit out. And no washing after that. And then she asked about the mineral water instead of tap water. I read an article, to be honest, the tap water, they have fluoride, but we don't know what's the concentration of the fluoride. So I cannot, for me personally, I sometimes forget when I do my tea or coffee. I do drink mineral water, but sometimes I just feel lazy. I put my tap water to do tea and coffee. So it doesn't matter. It depends on you.
Okay, I see. What about the danger of pacifier? And by what age they remove it? And is there any tips about this? And
Thank you so much for this question. Thank you so much for this question. And we say that the pacifier, by the age of 2, you're already late. By the age of 2, you're already late. Yeah.
Then
see, so this is How old is your child?
I don't want to tell you now.
10 year, he's still on pacifier? 3. No, you start pulling it out. You start
No,
pulling
we
it out.
started pulling it out. He just puts it a bit like before sleeping at night.
The most dangerous part is when he sleeps. So he should not sleep with it. I'll show you why the pacifier is important. On my Instagram, there is a video for parents on tips why explaining why the pacifier is wrong. So this is your normal bite.
Okay.
Okay. There are 4 things are equal to each other. People who thumb suck, people who uses the pacifier, people who drink with the bottle, and people who are breathing from their mouth where they're sleeping. Especially if your baby is breathing like this or he snores, you need to check your ENT. These 4 things are equal to each other. So I'll just, this is your tongue, you're sucking. What happens? See, I'm pulling it. It's excessive force. See what happens? This is exactly what happens.
Oh, yeah.
Okay. So the pacifier, you need to stop it. The baby will be grumpy. I know that. I confess that. But remember, at the first you control the kid does not control you. Because if the baby found you his way in, khalas, that's it.
Yeah, that's true. Doctor, I just have one question.
Please.
How do we encourage, how do we encourage them to keep their like dental routine in check and everything, but without creating also this fear of going to the doctor, especially for older kids who eat a lot of sugar, and then we have to follow up with them, like, go brush your teeth, you're gonna get cavities, you're gonna go to the doctor, and then it creates like a sort of fear. How do we avoid that?
First of all, it starts from the parents. So remember, we said that the kids are copycats. So I always tell my patients, are you brushing? I don't ask the child, I ask the parents, are you brushing? If the child sees you're brushing, he will brush. Yani you are the leader. He copies you, he learns from you. So the first thing is you brush. So you have to brush twice and floss so that he sees that your guy's doing, that he's doing what his parents are teaching him. So this is the first thing. Second thing, unfortunately, especially in the Arab world, we have this. If you don't listen, I'll take you to the doctor and give you an injection. Correct me if I'm wrong. Yeah. This is improving, to be honest, but we still have it. Yeah, you see this every day. So this is another thing, and do not use us as a threaten. So if some parents will see, you know what, if you don't brush, you will go to the dentist. So automatically the child is creating an idea that's a bad thing. So it's a punishment. So if I'm going to a doctor, it's a punishment. Especially if he or she has a bad experience with the pediatrician when it comes to vaccinations, to ENT. So that's why we always try to say positive things about the dentist. Yeah. Another thing is to encourage them by little tiny gifts. So either using an app or using a small table, just for example for a week, and divide, for example, Saturday, Sunday, Monday, the whole week, and morning and night, and tell them if you brush, you get a tick. If you get a brush at night, you get a tick. If you finish 1 week, you get a small gift. You finish a second week, each week you get small gift, and then after 1 month, sorry.
Yeah, like having a reward for him.
Exact. Kids love rewards. Kids love rewards. I'm giving them now electronic rewards. They are very happy about it. So yeah, the rewards thing. The rewards are the best. So it will work for them. So after it becomes first it becomes a mission, and then it becomes a habit. So khalas, automatically the kids will brush their teeth. Regarding sweets, I'm a big fan of sweets. I just want to buy chocolate. So yani, I will not tell you stop. I will not tell you stop chocolates. But يعني خير أمور الوسط, you hold the stick from the middle. My rule is very nice. Give sweets every day. Good deal. But there are a couple of conditions. First, it says a treat, so no lunch, no sweets. And when you say lunch, I'm talking about proper meal, proper lunch, not just a sandwich. No, a proper. Yes, you have to approve. If no lunch, no sweets. Second, it has to be maximum 5 o'clock. After 5, there is no sweets. Okay. Third, please avoid variety. I don't have a problem in quantity. For example, let's say they like Kinder. You're allowed to give 2 Kinders, but not 1 Kinder, 1 Kit Kat. Either a Kinder or a Kit Kat.
Why? Why is that?
I'll tell you why. Because subhanallah, digestion starts from the saliva. When you give the saliva one thing, it can focus. If you give it two things, it will spread out. It will not focus.
Wow.
So just give you one thing. Second, try your best to avoid sticky food. This is your worst enemy. Candies, caramels, gummy bears, toffees. Are your worst enemies. What I do recommend, which is better, I believe, is ice cream, especially the one, the licking one, because it usually doesn't stick. And especially in this heat, you would need an ice cream. We'd need an ice cream. So, and also
That's
if you
good
drink a
news.
lot of juices, sorry?
That's good news. Ice cream is the best choice.
Yes, yes. So yeah, and for juices or chocolate milk or strawberry milk, please make it once a day, and always drink it with a straw. And even for adults, guys, if you have
Okay.
I think
We're just having a bit of problem with the connection.
it's cutting.
It's
or-
cutting a bit. So
Can you hear us?
okay.
Now it's back. Yeah. Actually, we had two more questions. Cynthia was asking, should we change the toothpaste often? Yeah.
Yeah.
All right. So Cynthia was asking if we should change the toothpaste brand often, and Joy was asking for how long should we keep the same toothbrush?
for all of us, it should be not more than soft. Sarah, did you
Can
hear
you
my
please
answer?
repeat that? Because we didn't quite hear very well from, I think it's
Okay.
cutting a bit.
Yeah, I think now it's better. So I repeat, Hatar. So it doesn't matter the brand. What is more important is the content of the fluoride. So I'll just repeat it for you. 6 months to 2 years, it should be 500 ppm fluoride. 2 years to 6 years, it should be 1,000. Above 6 years, it should be 1,450. So to be honest, the only brand I found in Dubai is Vitus Kids that's having the 1,000 for now. I didn't find anyone
Okay.
else.
Okay.
All right. Actually, we have one more question, like related not to really toddler to small kids, but like to kids age of 6 and
Please.
above, when they start like having those wiggly teeth, and some of them should be pulled out. How, when, and what are the signs that we know that we should pull it out because the other one is down and it's not going up?
I just remembered one thing. So she asked also about the brush. It should be the brush for adults should be the brush should be changed every 3 months, even for kids and adults, and please not more than soft. More than soft, you're ruining your teeth. Okay. Regarding the wobbly teeth, if it's moving, yani she will eat a carrot, cucumber, anything hard, it will fall off. But there's something called shark's teeth. What is shark teeth? For example, this is your your baby teeth, and the new teeth is coming at the back.
Yeah.
Yeah.
Okay, if your baby teeth is not moving, then it needs to be pulled out so the new tooth comes in place. And there is no braces needed. Subhanallah, it automatically corrects itself.
Okay.
And is there any signs that he's not falling, his teeth are not falling, and he's like 7 years old. Is it any bad sign or is it a good sign?
No, it doesn't matter. He maybe just delayed eruption, but in that case, we recommend him to come and take an X-ray just to rule out that we don't have any missing teeth. Some people, subhanAllah, are born with missing teeth. So I have a case, it was very interesting. The 6-year-old molar came at the age of 9. So she's 3 years late. But as long as the teeth are there, we used to say, we get our popcorn and watch. We do nothing. We just wait.
All right. So she was asking, is delay in teeth falling off an indication of growth delay, or is it not linked?
It's not linked. It can be linked. But in order to do that, I have to send her to the pediatrician to check that the baby is on the correct percentile. For example, if the baby is in the correct height, if the baby is in correct weight, the body is okay, but she has delayed teething. So as I told you, I have this patient, mashallah, she's everything perfect. Her teeth are just late. It's just teeth. So it might be related, it might not be related.
Okay, perfect. So our last question is, it's a concern for every parent right now. It's actually, what are you doing in COVID-19 to protect yourself and the children? And for parents who are a bit hesitant in visiting the doctor, should they do something preventive before going, or what measures are you taking?
We're taking all the necessary measurements. Even the government give us the green light to do all the procedures. We're taking with our precautions. The first precautions, we say, if you're feeling sick, please do not come. This is the first precaution. The second, in our clinic, each patient with each member coming, for example, I see kids, so I check the temperature of the father and the mother. Of the father and the child. If they are sick, we tell them, please leave. If not, then khalas, we proceed. Plus, we sterilize between each and every single patient, and we will be wearing our PPE, or with the kids, I call them Superman. We wear all these things on: double mask, face shield, we wear gowns. We make also each patient gargle with a special mouthwash. For example, either betadine or even not the anti-caries. Vitis has, for example, Perio-Aid, like this one. This one. It's used now by research. If you gargle with it, it prevents transmission of COVID. You just use it as a gargle now. It's very good. You'll even find it on the website. And then with the procedures, and during the treatment, we make sure the room is ventilated. We take extra precautions during the COVID-19.
Okay,
great.
So from our side, does anyone else have any questions for Dr. Mina?
We actually answered and asked all the question. If anybody has any other question, please take us now, or we're gonna save the live, and we're gonna get your discount about the product as well, and we're gonna post it later on the app.
Sure.
So they can also take advantage of this discount.
Yeah. And if you have any questions that comes to mind later, you can just send us to Cloudhoods, or you can also contact Dr. Mina on his Instagram directly. Right?
Please, yeah.
Is there anything that you would like to say about like general tips or advice, or I think we covered everything?
I'll just repeat it quickly for you. So please, you brush. The rule is 2 by 2. So you brush for 2 minutes, 2 times per day, once before breakfast, once before you sleep. Flossing is mandatory every day, once per day. Please remember, flossing is 40% of your cleaning. If your child is above 6, start using an anti-caries mouthwash. And control your sweets, and do your regular checkup, please, every 6 months. Prevention is better than cure.
Perfect. Thank you so much.
Thank you so
You're
much.
welcome.
And thank you everyone for joining in our conversation.
You're welcome. And if you need to ask me anything, please tell me. I'll happy to answer.
For sure. Thanks a lot,
Okay.
Doctor.
You're welcome. Be safe. Bye-bye.
Bye. Bye.